patient enters a medical facility or hospital, he comes in with a great amount of hope and expectation that he will come out healthy, fit, and fine. But sometimes this does not happen. His health either worsens, or the worst to happen with him is death. Does indoor air pollution aggravate HAI? The estimated burden of unsafe care is 1 in 10 patients receiving health care. It is estimated that globally, of the 421 million patients hospitalized annually, 42.7 million patients suffer from adverse events, and major reasons being hospital associated infections. Hello and welcome. My name is Yogesh Kulkarni, and with more than 25 years of experience in the field of HVAC, I have executed residential, industrial, hotels, clean rooms, and healthcare facilities, understanding the specific requirements of each industry. And in this video, we will discuss about the hospital associated infections, also called as HAI, and the solutions to overcome it. So I request you to please see this video until the end. So we begin with the prevention of hospital acquired infections. This document is generated by the WHO, World Health Organization, and it is a very detailed guidelines which provides information on prevention of HAI, that is the hospital acquired infections. And they have also provided how the airborne contamination happens due to the droplets, and how these droplets carry over the infection to the other people. This document also further explains the importance of ventilation as to how fresh filtered air appropriately circulated will dilute and remove the airborne bacteria contamination and eliminate the smell. So the next one is National Patient Safety Implementation. This is a body of Government of India under the Ministry of Health and Family Welfare. Now, they have mentioned that the estimated burden of unsafe care is 1 in 10 patients receiving health care. It is estimated that globally, of the 421 million patients hospitalized annually, 42.7 million patients suffer from adverse event, and major reason being hospital associated infections. Now let us see what ASHE has to say about indoor air quality in healthcare facilities. But first, something about AHSE. ASHE is the largest association devoted to professionals who design, build, maintain, and operate hospitals and healthcare facilities. ASHE members include healthcare facility managers, engineers, architects, designers, contractors, infection control specialists, and others. So what does ASHE mention about indoor air quality in healthcare facilities? A building's HVAC system is designed to perform several tasks: filter, cool, heat, humidify, dehumidify, pressurize, and exhaust. Each of these tasks affect indoor air quality. For example, if incoming air is not properly filtered, excessive dust from the outdoor is drawn into the building. If supplied air is not conditioned or heated satisfactorily, occupants may experience thermal discomfort. If supplied air is not dehumidified appropriately, excessive relative humidity levels may promote microbiological growth. If patient isolation rooms are not properly pressurized, unwanted airborne transmissions of pathogenic bacteria may occur. If airborne chemicals are not properly exhausted from laboratories, these chemicals may migrate into the laboratory spaces. These are just a few examples of how the performance of the HVAC system can affect indoor air quality. So before we conclude, I would like to show you a document by WHO, World Health Organization,
which are the guidelines on the ventilation for the healthcare facilities, which mentions natural ventilation for infection control in healthcare settings. And this also is a very exhaustive document that they have created, which describes various aspects of ventilation in healthcare facilities. First of all, it describes the general principles of infection control, the isolation practices, various isolation practices that have to be carried out, etc. Then it also mentions about isolation practices of airborne infections. After that, in the concepts of ventilation, they have also provided what is natural ventilation, what is mechanical ventilation, what is hybrid or mixed mode of ventilation. Then difference between mechanical ventilation and natural ventilation is also given over here. So this is a very exhaustive document that WHO has provided. Then infection and ventilation, the association between ventilation and infection has been provided. The ventilation requirements related to the airborne infection control, etc. Are provided. So everything, this document is completely related to infection and ventilation in a healthcare facility. So you can understand the importance that WHO is giving to air conditioning and ventilation systems in a healthcare facility, which is of so very importance.
Ventilation requirements relating to airborne infection control. This is a part of the same document about ventilation by WHO, which mentions that ventilation can reduce the concentration of airborne pathogens through removing or diluting airborne droplet nuclei. A higher ventilation rate can provide a higher dilution capacity and consequently potentially reduce the risk of airborne infections. So, to summarize, we discussed on the important authorities and associations whose verdict or say matters in the healthcare sectors, and each one of them have given a great importance to indoor air quality and the spread of infection. In fact, they have spoken about the deaths which occur due to infection and aggravation of this infection due to indoor air pollution, which may happen due to sick people. In fact, the WHO document Prevention of Hospital-Acquired Infections mentions the various types of isolation rooms for various types of infections, while the document Natural Ventilation for Infection Control in Healthcare Facilities by WHO mentions the different ventilation rates and the air changes per hour required for different rooms in the healthcare facility. So there are various such articles and publications by experts which indicate the role of indoor air pollution in aggravating infections in enclosed places, but we have selected those few which matter in the healthcare sector and observed the importance they have given to the indoor air quality. We provide HVAC audits, which is a system by system evaluation of the performance and the efficiency of your HVAC systems. And we highly recommend demand control ventilation systems, especially in healthcare facilities. You can kindly contact us for more details on the contact number provided on the screen. And I thank you for listening to my complete video. Thank you.